The political temperature in Washington is always high, but it rises even higher when a government shutdown looms. Congressman James Comer, a key Republican voice, recently took to the airwaves. He laid out a series of serious charges. Comer linked the shutdown threat directly to what he called free healthcare for illegals. He argued that taxpayer money is being spent on this. He claimed this spending is a major reason why lawmakers are struggling to agree on a budget. This creates a powerful political narrative. It connects two very emotional issues: immigration, government spending. It suggests that one is causing the other. Comer's argument is straightforward. He says the Biden administration is prioritizing undocumented immigrants. He claims they are getting comprehensive health care at no cost. This, he says, is happening while American citizens struggle with their own medical bills. He paints a picture of a system that is unfair. He suggests it is an out-of-control drain on public funds. This is the kind of message that resonates, positioning Republicans as fiscally responsible protectors of taxpayers, a high-stakes political strategy. Let's break down what the law actually says. It is a common misconception that undocumented immigrants can get free health care easily. The reality is much more restricted. Federal law is very clear on this point. The Personal Responsibility and Work Opportunity Reconciliation Act of 1996 established strict limits. This law bars undocumented immigrants from enrolling in most federally funded health programs: Medicaid, CHIP, ACA marketplace subsidies. Signing up for a full coverage government plan is not supported by the law. So, what is allowed? A very specific exception: emergency medical conditions mandated by EMTALA. Hospitals that accept Medicare must provide emergency care to anyone who needs it, regardless of status or ability to pay. It is about stabilizing life-threatening conditions: heart attack, serious car accident, emergency childbirth. Emergency care is not a regular health insurance plan. It does not cover preventive checkups or cancer screenings. It does not cover chronic care like diabetes or hypertension management. Strictly acute emergencies. Once stabilized, the obligation ends. A safety net, not a comprehensive system. When we look at the numbers, a different picture emerges. The cost of emergency Medicaid is often the focus. Let's put it in context. Total Medicaid spending is enormous. It covers low-income Americans, children, pregnant women, and people with disabilities. In a recent fiscal year, federal and state spending on Medicaid was over $800 billion. Emergency Medicaid for undocumented patients is less than 1% of that total. In some analyses, closer to 0.5%. For every Medicaid dollar, less than a penny goes to this care. 1% of $800 billion is $8 billion, a small slice of a very large pie. Over 99% support citizens and eligible legal residents. If hospitals were not reimbursed, costs become uncompensated care. They do not disappear. Hospitals pass costs to patients and insurers, driving higher prices and premiums. Emergency Medicaid is a more direct way to handle a cost the system would bear anyway. The narrative that this spending drives deficits or shutdowns does not align with data. The numbers show a minor expense within a much larger system. Let's fact-check Congressman Comer's central claims one by one. His main point: free healthcare for illegals is a major government expense. Based on law and data, this is a significant exaggeration. Federal law prohibits undocumented immigrants from accessing comprehensive plans like Medicaid and bars ACA subsidies. The only exception is life-threatening emergencies. Calling it free healthcare is misleading. The system is designed for stabilization, not subscription. Next, is this spending a primary reason for a potential government shutdown? This claim is not supported by facts. Emergency Medicaid is under 1% of the Medicaid budget. Budget negotiations involve much larger issues: defense, education, transportation, social programs. To single out this tiny sliver as the main sticking point is political theater, not fiscal reality. Accessing emergency Medicaid is not automatic. Patients must prove a qualifying emergency and meet low-income criteria with verification. Some taxpayer money is spent, true. The disconnect is scale and scope. Emergencies only. Tiny fraction of total spending. When a government shutdown looms, the political posturing intensifies. It becomes a high-stakes game of chicken. Each side tries to blame the other. Using healthcare for immigrants is a powerful tool. It frames border security and fiscal responsibility. It is easy to understand and emotionally charged. It can mobilize a base and put Democrats on defense. However, real shutdown drivers are broader. Top-line spending numbers for the next fiscal year. Some House Republicans want deep cuts and rollbacks. The White House and Senate Democrats push back. Policy riders on abortion, environmental rules, and Ukraine funding are major points of contention. Focusing on immigrant healthcare is a wedge strategy. Easier to sell than cuts to education or infrastructure, even if it misstates the core legislative fight. It is designed to win the public relations battle, not to reflect the main budget impasse. Separate from the budget debate, another accusation: the Autopen. It is a machine that holds a pen and can replicate a person's signature. It has been used by presidents and officials for decades. It is not a secret and is practical. A president signs thousands of documents: legislation, executive orders, official correspondence, and photographs. Using Autopen for routine, non-controversial documents is long-standing. DOJ opinions support validity when the president knows the document and directs his signature be affixed. Critics claim it's used without Biden's knowledge, implying infirmity or unauthorized staff action. To prove wrongdoing requires showing a specific document was Autopen signed against his wishes or without consent. Pointing out Autopen use alone is not conspiracy. It reflects normal White House operations over 70 years. The challenge for critics is providing concrete proof that the long-standing practice is being abused. So, where does this leave us? Let's distill it down to the essentials. Some taxpayer money reimburses hospitals for emergency care for undocumented immigrants through emergency Medicaid. This is a fact. Comer's vast free healthcare claim is a big exaggeration. The law limits care to emergencies, not routine or preventive medicine. The scope is narrow, not comprehensive. This spending is not the main cause of a shutdown. It is under 1% of Medicaid. The real fights: overall spending levels, defense funding, aid to Ukraine, and other divisive policy riders. Focusing on the small fraction is political strategy, more about messaging than math. On Autopen, presidents have used it for decades. Use alone isn't wrongdoing. Claims of misuse remain unsubstantiated. Watch emotionally charged phrases and ask for context. As deadlines near, check if they argue about the 1% or the 99%. On Autopen, the burden of proof is on accusers. Stay informed.